Good morning and welcome to the October edition of the Medicaid Monthly Virtual Meeting. We will give it just a moment as folks start to come in, and we appreciate you being with us today. It looks like it has slowed down a bit from letting people in. Good morning. My name is Veronica Judy Cecil. I'm Senior Deputy Commissioner here with the Kentucky Department for Medicaid Services. We appreciate you joining us today for our Medicaid Monthly Virtual Meeting, taking out the time in your, I'm sure, busy schedule to join us and hear some updates about the Medicaid program. And for those of you who take the opportunity to also watch it in its recorded version, we appreciate you taking that time as well. We do have a full agenda today as we normally do. Next slide, please. We'll be providing a lot of the regular standing updates. That includes our Medicaid renewals and our update on the state-based marketplace. We've got several folks on to provide updates on several of our waivers, including the 1915I rise, the 1915C child waiver, and the 1115 re-entry. And we, of course, have our fabulous Dr. Judy Terrio here to give us the monthly Our Healthy Kentucky Home Spotlight. And then we are going to touch on the federal shutdown. I'm sure several folks have questions or are interested in understanding the impact to Medicaid. We have a very short update on House Resolution 1, and then as a continuing of the information we try to provide about the implementation of various federal final rules. We'll provide an update on the Medicaid Advisory Committee and Beneficiary Advisory Council that was implemented as part of one of the rules. So let's get started. Next slide, please. This is our snapshot of our renewals and enrollment and its impact on our enrollment throughout the last 2 years, as you can see. And we did level out pretty significantly over several months. And then now we do see a slight drop. Part of this is, we believe, related to child renewals, although we restarted child renewals with July renewals, and the numbers are small. We are seeing a slight decrease now that we are performing that full redetermination on children that was paused during the public health emergency and was paused following the public health emergency as a flexibility through the end of June 2025. Next slide, please. So for our September Medicaid renewals, you see our number here. We had 90,922 individuals that went through renewal. We were able to approve 79,466 of those, so still a really high approval rate from month to month. Our terminations were 10,796. And as we crossed over on that last day in September, we had 660 cases pending. A pending case is one where a member has responded to either a request for information or to a renewal notice, needing additional information to make a redetermination, and the state had not yet acted on it. So these folks do maintain eligibility as we cross over and are pending. Next slide, please. This is a snapshot of those renewals by age, just focusing a little bit on the child renewals, and we are going to dig a little deeper into those in the next couple of slides. But as you can see, the blue and the orange are the ones for children. A high approval rate for them as well, but as you see on the right-hand side, especially in that 7 to 18-year-old age range, that's a fairly high number. So we're kind of watching those every month, and especially when the number creeps up like that. Next slide, please. So this is showing you the child renewals and how they were processed. Excuse me, one moment. And on the far right, what you see there is what we call passive renewal. And by passive, that means we're able to go out and check various data sources. And if we can verify eligibility through those data sources, members are automatically renewed. They have to take no action. And so on the far right there, you see the children that were able to be renewed automatically with no further information needed. The middle column there is about passive with RFI, and that's request for information. So we did go out. We were able to primarily verify their eligibility. There just might have been one or two things that needed to be verified, and so those individuals received a request for information to complete that verification. And then the far right there is active. We always try to do an automatic renewal for everyone, but we can tell early into that process that somebody needs an actual renewal packet because there's a great deal of information that we do not have and that has to be verified. So that is sent a little differently. It's a pre-populated renewal packet, and we ask the folks to verify or provide the additional information that's required. So that's what the active bucket there you see there. The blue is those who were approved as a result of each of these activities, and the orange is those who were terminated. Next slide, please. And this is just looking at child terminations by reason. So that big bucket, the 3,945 is unfortunately due to failure to return a form, or so the renewal form or that request for information. A lot of times what we see is that folks think that their child's not eligible, and so that the form is not returned. We are working a lot on outreach to make folks understand that the eligibility criteria for children is different. There's a higher income level for children. And so we try to encourage folks to still return the information and let us make that determination as to whether or not they're eligible or not eligible. So that is the largest number of individuals, of children who have been terminated. And it's on the adult side too. It is the largest number of adults who get terminated is for failure to return. And the middle one there is about being determined ineligible for benefits. So that shows that 1,100 actually went through a redetermination and were determined ineligible. And then that bottom bucket is generally that a child, someone has made a request for a child to be disenrolled or terminated as part of that renewal that's assigned to the September renewals. Next slide, please. We go over this information every month, but I do like to always point out a couple of things. It is right now an annual, so every 12-month renewal. It's from the member's original month of enrollment generally, or we did redistribute cases as part of unwinding and the restart of renewals. So their original month may have changed, but it's from that month. So we have folks who are renewing throughout the year. We have a different month of renewal. We do send that renewal notice at least 45 days before the end of their renewal month. We generally start the renewal process at the beginning of the month before their renewal. We try to do that passive renewal where we can automatically approve them. And then as they are not able to go through that and be automatically renewed, we drop down to the renewal notice, the renewal packet, or the request for information. But all that happens at least 45 days, trying to get members enough time to receive it, to provide the necessary information before the last day of the month of their renewal month. We do send a reminder 15 days prior to that end of the month if we've not received anything back from someone. So we do try to reach back out to them. We do that through various ways. We do texts, we do emails, we do phone calls. The managed care organizations help with that outreach as well for their members, for the individuals enrolled with them. So not only is the state trying to contact them, the managed care organizations are trying to contact them just to make sure they understand they do have to take action. And if they do not, they will be terminated. We've got lots of ways to support folks navigating the renewal process and application process. They can go on to Connect, and they are able to create a self-service portal account, and they can go in and apply or renew through that account. They can call the Connect line and receive assistance. And then we've got folks all over the state called connectors that can support folks in helping understand and submit documentations for their renewal or for application. Insurance agents are also able to assist folks, and so we encourage anyone who needs that support to access either a connector, an insurance agent, or of course, they could utilize the local DCBS, Department of Community-Based Services office for that help. And we do encourage folks to try to respond by the due date, or if for some reason they happen to miss that, to try to do it within the 90 days following. We no longer have a flexibility to automatically reinstate somebody's coverage back 90 days like we did during the the unwinding of the public health emergency. But there is a difference in what the eligibility worker can do to either just reactivate the case, or whether or not, if it's outside the 90 days, someone might have to actually reapply, and that could require, having to provide information, updated information. Next slide, please. I do want to mention one thing I did leave out that I think is kind of really helpful. We added the renewal date for all members in the Kentucky Health Net. That is the portal in which providers can come in and check a member's eligibility. And when they do that, they can see the redetermination date. So we always are asking providers to please take that opportunity when a member is coming in for an office visit to check that. And if it is the month of the renewal, or if the renewal is coming up in the next couple of months, is to mention that to the member so they can keep an eye out for any notices that they would be sent. And we have a lot of information out on our website that, we ask anyone to utilize if they're providing support to members who navigate renewals. These can be downloaded, they can be shared, posted. We really encourage, especially providers, to post this information so that members see it when they come in and they know how to access help if needed. Next slide, please. We also have a whole host of ones directed to child renewals. We have a child renewal toolkit, which helps with a lot of frequently asked questions, helps direct people for any support they may need. We've shared this information with the Friskies in all 120 counties, and I think they have over 1,200 schools that has a Frisky. And we just ask people to continue to share the information and make sure folks understand that children are subject to a renewal now, and that there are ways out there to support them as the families navigate. Next slide, please. This is just a snapshot of our updated renewal website. And this is where we post the slides and the recording from today. The Medicaid renewal information I went over about September renewals, that report that we send to CMS, the Centers for Medicare and Medicaid Services, is on this website, as well as updated reports where we are required every 90 days following a month of renewal to update CMS on any pending cases that are processed. So for example, in 90 days, we'll need to file a report with CMS on the 660 that were pending at the end of September. So all that information is out on our website, all the flyers and other communication tools. So we encourage folks to utilize that. Next slide, please. And just a really quick update on state-based marketplace. Although the enhanced tax credits that were making the additional enhanced tax credits that were making premiums affordable have gone away for 2026. There are still premium tax credits. So, we're encouraging folks to still get on and shop, make sure they renew. And open enrollment does start November 1 and goes through January 15th of 2026. I do believe our shopping tool is now live on the marketplace. So go to Connect, and that's where you can get more information about what the 2026 rates are and how they may impact you. We are, still holding on a little hope that Congress will act to bring back those increased tax credits, and we will keep folks updated in the event that happens. Next slide, please. And I did note a question in the chat, and I will answer that in the chat, and so we can go ahead and move on to Tanya Dickinson, who's here from our sister agency, the Department for Behavioral Health, Developmental, and Intellectual Disability. And turn over to you, Tanya.
Thank you. And that is why we call it BDID instead of Department for Behavioral Health, Developmental, and Intellectual Disabilities. You repeat that too often and you go a little crazy. I'm Tanya Dickinson. I'm working with the 1915I RISE initiative implementation with BDID and our sister agency, Medicaid. And just give you a real quick overview of the program, talk about where, and then talk a little bit about where our current status is, and then I've got some resources and things I'll put in the chat at the very end of that. 1915I RISE initiative, for those of you who may be unfamiliar, is a joint effort between our two departments and focuses on helping individuals rise above their challenges through services that promote recovery, independence, support, and engagement in the community for individuals with a serious mental illness or a serious mental illness with a co-occurring substance use disorder. Next slide, please. The 1915I RISE initiative is a update to the state plan, an amendment to the state plan. It's similar to 1915C waivers, but it's distinct as an amendment to the state plan and has no limit on the number of participants served. So there's no slots like the C programs. Participant services are direct billed to Medicaid, not through MCOs. So when an individual joins the program, their Medicaid coverage converts that way. We began accepting provider applications for certification to provide services on July 1st, and we'll announce the date to start enrolling individuals into the programs soon. And you can visit our website to read more about the program and its services in depth. I'll put that link in the chat also. Specifically, 1915I RISE is designed for Medicaid eligible adults with a serious mental illness who've had who need some assistance with various life areas. We've had hospital inquiries, correctional facilities about transition for folks who are coming out of those, and we think that will be part of their transition planning. We're not able to yet accept participant referrals, but if you have someone with an interest in in becoming a participant, you can send their name to our 1959 RISE Initiative email, and we'll add you to our follow-up contact list and reach out as soon as those become available. All participants are screened and assessed as they enter the program to determine their needs and services. And then the individual participant may select a case manager from a list of approved providers on BDID's webpage. The case manager then assists those individuals in obtaining providers for the other services offered by the program. And all of those are also available to be reviewed on our provider directory on our webpage. Overall, the RISE initiative has 10 essential home and community-based services that are delivered in communities, and each has specific eligibility and service requirements that's part of the screening, assessment, and person-centered plan development that every individual goes through. Real quick, they're assistive technology for things like medication reminders and whatnot, case management, as I said, housing and tenancy supports, in-home independent living supports, medication management, planned respite for caregivers, supervised residential care, supported education and employment, and transportation for non-medical appointments and things like that. The specific requirements for each of those 1959 RISE services for providers and participants, if they wish to review them, are in the Kentucky Administrative Regulations, Title 907, Chapter 16. And you should note that participants receiving any of the housing services must be homeless, at risk of homelessness, or formerly homeless within the past 24 months, or they may now be residing in HUD-assisted housing and have a history of frequent nursing home or inpatient stays. These services can be received along with other complementary programs like AOT, as long as they aren't duplicating services. Next slide, please. So far, just to bring folks up to date with us, we've received 13 applications for certification to date, and many are still in the development process, and additional ones are coming in all the time. Some providers plan to offer services statewide, some within specific community mental health center regions or counties, and some will be offering a long list of the services, as well as a few will just be, or some will just be specializing in only one service that they want to concentrate on. As soon as we have all services available within a given community mental health center region, we'll begin accepting participant referrals from that region by contacting folks on our follow-up lists and making public announcements and generally reaching out through all of our channels. And again, if you know of somebody who might be interested, you can send their information to our 1959 RISE Initiative email address, and we will contact them in the future. And I'll put that in the chat here in just a minute. The provider fee schedule and resources for providers as well as participants, governing regulations, program development, history, application process, and all of that is at our program's webpage. And we encourage folks to go there and check it out so that you can follow up with us with any questions that aren't answered there. We hope to have everything there, but there's always something that we've missed. Finally, I want to let folks know that we have office hours every Monday and Wednesday from 3 to 4 p.m. Eastern Time on Zoom for providers who may be interested in joining the program. It's kind of a casual atmosphere. You're welcome to come and bring your questions about pre-certification questions, applications, questions because you're working on the application, or for folks who have been certified, then we'll look for you. We'll be happy to answer for you there too. Like I said, we've got 12 that are in process somewhere along the way. Recently certified our first provider, and we have 100 or so folks registered within our online system to begin the application process, or to examine it at least. And we've had 150 or so providers register to attend the office hours session. So we're gathering momentum as we go, and we're looking forward to really being able to start expanding here in the very near future. But I think that's all I have for you today, and I'll go put the information in the chat room for you now. Thank you.
All right, I believe that leaves it to me at this point. My name is Kristen Schroyer. I'm one of the behavioral health specialists inside the Department of Medicaid. To give you our reentry status update, we don't have a lot of new going on, but I just want to make sure that everyone knows kind of where we're at. Next slide, please. So just a reminder, our 1115 reentry program is for all adults and youth who would be eligible for Medicaid, if not for their current incarceration. This is going to be within our Department of Corrections, the state prisons, and within our youth development centers with DJJ. For this program, all eligible will receive case management 60 days prior to release and 12 months, up to 12 months post-release. This covers medication-assisted treatment, which is both the medication and the therapies, and then a 30-day supply of all clinically required prescription medications and durable medical equipment when necessary upon release. So we are currently still working through our program design for the delivery of the pre-release services, actively working to make sure all of our systems align across the platforms. This has probably been our biggest lift, is all the number of systems that are truly involved in this program. We're continuing to collaborate with our justice partners, working on credentialing, and then provider training and readiness is going to continue throughout 2025 into early 2026. Our systems got up and running this month in October. So we are excited about that because that is a fresh step for us. And that's going to make sure that we are ready for the billing, for medications, for PAs, for case management, as I said, but several systems. So testing has started, and that part is exciting. Next screen, please. So the Consolidated Appropriations Act, CAA, Section 5121, this was federally mandated in 2023. And we had already started our reentry, and this just kind of plays along as well. So this is for our youth who are Medicaid eligible at incarceration, under 21 or former foster care youth. So that would be the 18 to 26. This is also going to be in our 14 state prisons and our youth development centers. For CAA, this is going to be able to provide screening and diagnostic services for medical, dental, vision, behavioral health screenings, 30 days prior to release, just trying to get those needs ready to be met once they're released. And then targeted case management, also 30 days prior to release and for at least the 30 days after that release. We did receive a CAA grant to help us with some of these parts and pieces. Like I said, our technology is probably one of the biggest ones because it's not just for Department of Medicaid, it's for our justice partners and everything in between. And so that got kicked off in August, and we are just currently awaiting for the release of our funds, which should be coming very shortly. And that is my updates for today.
Thank you, Kristen, and that brings us to me. Hi, I'm Carmen Hancock. I'm the Director for the Division of Long-Term Services and Supports here with Kentucky Medicaid, and I am here today to talk to you all about the 1915C Child Waiver, Community Health for Improved Lives and Development. Next slide, please. So, what is the 1915C Child Waiver? The child waiver is a new Kentucky Medicaid program designed to help Kentucky children and youth with the most significant behavioral health or developmental challenges to get the services that they need while staying at home, in school, and in their communities. Our anticipated go live right now is January 2026. And again, the focus here is on children and youth with the most complex needs. So youth who might be coming out of an acute inpatient hospital stay, be at risk of out-of-home placement due to requiring intensive behavioral health and residential supports. Also, one of the features in this child waiver is clinical therapeutic services designed to foster a real step-down approach, coming with the highest level of care, so returning into home and into the community. This is intended to serve that population of kiddos who would qualify for an ICF, psychiatric hospital, or inpatient hospital stay. Next slide, please. So who does the 1915C child waiver help? This is children and youth, again, under the age of 21 with significant behavioral health or developmental needs. Also, children in Kentucky who need a level of care like would be provided in an inpatient facility, an intermediate care facility for individuals with intellectual and developmental disabilities, or a hospital, like I said. All of that being said, they do have to be able to be safely supported at home or in the community with the right set of services. And obviously the goal is for the child waiver to be able to provide that right set of services. Next slide, please. Here's just a snapshot of the services that we are going to be providing through the 1915C child waiver: case management, community living supports, environmental and minor home modifications, respite for caregivers, supervised residential care, and those clinical and therapeutic services that I mentioned previously. Next slide. So in recent news, very exciting, we're moving along at a quick clip with developing this much needed program. Last week, we sent out a call for child waiver providers. We're just sort of dipping our toes in and seeing what the potential provider base looks like out there. We have already gotten over 100 responses to this call for providers. So we're very excited about being able to develop a strong foundational provider base for this set of children. We also are in what we hope are the final stages of conversations with CMS. We are fairly certain that we will see an approval on this waiver application within the next few weeks. And for those providers who have responded already to this call, to this outreach, we will be getting in touch with you all likely early November to start scheduling training opportunities, outreach, and help working through that certification process to get folks up and running quickly. So more to come. We will keep you abreast as things unfold, and we're just very excited to get this up and going. Thank you.
Can you hear me? Next slide, please. I'm going to talk to you about our Healthy Kentucky Home. One last time, this is wrapping up our annual journey. This whole time we've been talking about eating healthy, exercising, and engaging with others. And we've talked a little bit about different things through, women's health, men's health, things like that throughout the year. And this is just wrapping it up. So next slide. now we've talked every month about having at least 2 servings of fruits and vegetables a day, which it has been our goal. And just remember that you are what you eat. If you're eating healthy foods, your body will respond better and be able to work better. Uh, Vitamins come from your fruits and vegetables, protein from your beans and your lean meats. And maybe some endorphins come from this chocolate that's down here in the bottom. So fill your body with the nutrients and the fuel that it needs to be healthy. And starting with 2 fruits and vegetables. I'm so sorry, I hope you can't hear that. Next slide. Regular physical activity is very important. And what you want to try and do is 30 minutes of exercise 3 times a week. It doesn't have to be running a marathon. It can be finding something that you like to do, walking the dog, swimming laps. It's something, if you like it, you're more likely to stick to it. And 30 minutes, 3 times a day, 3 times a week would be ideal. You don't have to do anything crazy. And it's easier if you get yourself an exercise buddy. So it helps, for accountability. Next slide. And social engagement is the third part of our Healthy Kentucky Home. And when you're engaging with others, you are it's a buffer against stress. It helps with anxiety. It builds resilience. And people with strong social connections will have less depression. And so what you want to do, you can volunteer, you can join clubs, and you can just have casual gatherings with friends, just like in the picture. Next slide. Now, this is not the end, even though we've had the whole year to talk about this. So phase 2 of our Healthy Kentucky Home is going to bring you information on different things, different programs that we have in our communities throughout the state to help people. And so, for example, one of the sessions will be on community health workers and how they can be a wonderful resource for lots of people. And so that's just a plug for next year. Again, exercising, social connection, and giving your body what it needs to be strong. And that's it. Thank you guys so much.
Senior Deputy Commissioner, you're muted.
Yes.
It didn't click. Sorry. Thank you. Thank you for that, for noting that. I was just saying that I can't believe it's been a year that we've been bringing the My Healthy Kentucky Home to you folks here on a monthly basis and the campaign across the state. It's unbelievable that has gone by so fast. I do hope we've gotten some really great feedback around it. And I think people have really enjoyed the information that's been provided. We look forward to continuing the campaign. And we're just hoping that it makes some small difference, well, large difference, but at least a difference in everyone's lives as we try to improve the health of Kentuckians. So thank you, Dr. Terrio, always for every month for providing that for us. Just a little update about the federal shutdown. We want to acknowledge that that is happening. We do want folks to understand Medicaid is a mandatory program, which means that when there is a federal shutdown, things kind of run as business as usual. And the same thing happens with the state-based marketplace. And so we continue to process claims. Providers can continue to see individuals, Medicaid members. This does affect other programs like SNAP and TANF. But for now, Medicaid is not impacted, even if the shutdown continues through, November, which I think is being discussed right now. So just wanted to give everybody some assurance that at least for Medicaid, it is business as usual. And there should be no impact to the delivery of services and the payment of claims during this period of time. All right, next slide, please. And speaking of federal, we are trying to provide updates on a regular basis about House Resolution 1, which was passed by Congress and signed into law on July 4th. Next slide, please. There were many components to that, and we have talked about that on a previous meeting. A couple months ago, we really kind of dived into the provisions that primarily impact Medicaid. And there are several eligibility provisions. They have, though, implementation dates and effective dates that don't happen until December 31st, 2026. So we're really trying to focus on those provisions that have a more immediate implementation or effective date. And one of those is the Rural Health Transformation Program. As we've discussed previously, this is $50 billion. This will be given out over 5 federal fiscal years. They're going to do $10 billion per year. They've split this $50 billion into kind of 2 pots. $1 billion is 25. There's $25 billion. So half of it is going to be shared among states that are awarded funds through an application process. And then the other half, the other $25 billion, is going to be given to states or distributed based on various factors that have to do with rural population, rural health facilities, and other rural health needs. We don't have full view into what all that criteria, what those requirements might be that they're going to make that decision on. But, we will wait to hear additional information as it comes available to us. The application part of this is due November 5th. I don't believe that this had been released prior to our previous meeting, so we just want to make folks understand a little bit about this. There's only one application per state. So, and this is the only application opportunity. So if states do not submit an application by November 5th, they will not be allowed to be awarded funds for that first 25 billion bucket. The state of Kentucky absolutely is going to be filing an application. Grant funds are going to be awarded by December 31st. So once the applications are received by the Health and Human Services Department and reviewed, we should know something about what Kentucky will receive by December 31st. These are program goals, as we show on here, that are required to be addressed as part of the application process. States have to have a very robust data and evidence to support whatever goals they are proposing as part of their application. Kentucky, and as a reminder, did solicit, we did ask for proposals from, I don't know, like over 40 different organizations across the state. They were provider organizations. They were organizations with some expertise in rural health, advocacy organizations. So we did ask for input from various organizations across the state on what they believe Kentucky should focus on as part of its application or its plan. What's a couple things to note is that the federal government has been very clear that this is not to supplant payment for services currently covered. So we can't take these funds and pay for clinical care that's already covered by Medicaid. We also can't take these funds and just replace the funds that are potentially going to be lost as part of other provisions in HR 1 that is reducing the payments to hospitals, for example. They really want this transformation is really the point here, and sustainability. So they want states to think about ways to improve access to healthcare in the rural areas, and to find ways to transform it and sustain that without having grant funds. So anything that we do implement, we have to be able to do and know that there will not be sustaining grant funds beyond that 5-year period. So we are working on the plan. There's, like I mentioned, a lot of information that has to be part of that. All the data is being assessed. We're working directly with several different organizations to help support that data that we need. And we will keep folks updated as best we can as we work towards that November 5th deadline. We just appreciate the information and the input that we've received to date. We're continuing to collect it. We've had organizations reach out with, some really great ideas beyond the deadline that we had. So we're not turning away any good ideas to make sure that we're keeping it all in consideration for whatever program or plan that we develop. Next slide, please. So I mentioned in the beginning of this meeting that we have been trying to provide updates on, there were 9 federal final rules that were implemented over a couple of years, primarily 2024, and that was requiring the state Medicaid agency to have to make various changes over the next several years. And one of those changes had to do with new requirements around a Medicaid advisory committee and requiring states to create a new beneficiary advisory council. So we have been working over many months to implement those federal requirements, and I'm happy to say that both the committee and the council have been established. The members have been appointed. All that information is on websites that I'll share with you, but wanted to give you an update on where things are. Next slide, please. So our Beneficiary Advisory Council had their very first meeting on October 13th. And we conducted a private meeting as permitted by the federal rule, the federal requirements. And the reason for that is to give members a little bit of a kind of a safe environment in which to share information and have conversations. So that the very first meeting was private, and we in that did a lot of organizational agenda items. We did elect officers, and as you can see here, Emily Beauregard has been elected chair, Eric Wright as vice chair, and Kelly Jo Blair as secretary. So we were excited to get those officers elected, and we'll be working with them on the upcoming meetings and agenda items to have smooth meetings. They adopted bylaws. They established a meeting schedule, and they made the decision to meet the second Monday of every month, starting in January from 2 to 4 p.m. These meetings will continue to be private or closed unless the members unanimously vote to open the meeting to the public. And if that happens, then we will send out public notices to and have an opportunity for the public to be able to attend as we move forward. So the minutes from the meeting that we just held on Monday, the bylaws, and the meeting schedule will all be posted to the Beneficiary Advisory Council website. The best way to find that is to Google Kentucky Beneficiary Advisory Council, but I've noted the link here in the slide. So when we send these out, you can certainly find it that way too. Next slide, please. And our Medicaid Advisory Committee. So just as a reminder, we've had a Medicaid Advisory Committee for a while, and it's it's officially called the Committee on Medical Assistance. It was created in statute as a result of, in Kentucky statute, Kentucky state law, as a result of a federal law that has been around for a long time requiring states to have an advisory council on medical assistance. To implement the new federal changes and requirements, we have taken that state law membership, we've changed it to be in compliance, and then we reappointed some of the old members of the advisory council, and we appointed several new members. So we have a brand new committee, and that membership list is on the website for the Medicaid Advisory Committee if you're interested. So their first meeting has been scheduled for November 3rd. It also will be from 2 to 4 p.m. It is currently 100% virtual, but we are working on an in-person option. We've been trying to find a location that is accessible, that is large enough to allow in-person attendance. We've been struggling with that, but we are committed to trying to have meetings going forward that provide that hybrid type of approach, both an in-person and a virtual option, and as well as a call-in, those three various ways in which to participate in these meetings going forward. The first meeting is going to be similar to the beneficiary meeting, that we're going to be very organizational in nature. We need to elect a chair, a vice chair, and secretary. They need to review and adopt the bylaws for them and establish a regular meeting schedule. So the agenda will be very focused on all the organizational requirements to get the committee up and running. We have posted the meeting date, time, and link to the meeting, the Zoom link to the meeting on our website, the Medicaid Advisory Committee website. That link is there, or again, really easy to find it by Googling Kentucky Medicaid Advisory Committee. So you can find more information there. Next slide, please. And then I do want to note, so for some of those other federal final rules, we do have some upcoming effective dates in 2026. So we will start to bring those to this meeting to keep everyone informed of what the agency is doing to implement all those requirements. So I just want to note that for future meetings, we're going to do our best to let folks know what work is going on, and questions that you all might have on the implementation of those requirements. So I will pause, and I did see a question about, does this affect waivers also? Do you know? And I apologize, Carol Ann, that I did not know what conversation was happening when, if that was about the federal shutdown. I can tell you that there is no impact to the waivers as well on the federal shutdown, if your question was around that. But I will again pause for just a moment to see if there are any additional questions in the chat. Okay, next slide, please. As always, we are looking for topics that you all want to hear about. This meeting is for you. And so if there are things that we're not talking about that you'd like to hear about, please let us know. We're always calling for agenda items. We do our best to try to keep folks updated on what we think you might want to hear about, but it's really important to know from you what those things might be. So don't hesitate to reach out to us, and we will actually end a little early, which is unusual for us, but give you some time back. Again, thank you again for joining us. We always enjoy this time to be able to provide information and answer questions. So have a great day.